My name is Bessie Malila, and I'm a postdoc at the University of Cape Town. Okay, my ongoing research is part of an ecosystem of research going on regarding the investigation into image analysis and how these images can be securely transferred between a source of acquisition. This can be a care home, as highlighted as we focus on this conference, or it can be in a home, a private home, or in a remote clinic or doctor surgery. This information is shared over the public mobile networks to web servers for storage or for processing servers, like in research centers, in our example for image analysis. So my focus is to look at how this information can be securely transferred between the different sources to the different destinations. With a focus on this conference, we believe that secure sharing of health data for the elderly in care homes can ensure the privacy of personally identifying information and the timely availability of the information for diagnosis and treatment. So digital health systems provide a platform for remote exchange of data to aid diagnosis, treatment, and provide remote training for health specialists. Telehealth is a subdiscipline of digital health, which uses ICTs, mobile and internet technologies to provide remote healthcare services. Telehealth services in elderly care homes can be used for biometric tracing and therapeutic applications, activity tracking, location tracking, medication reminders. Information can also be obtained from smart medical implants such as cardiac pacemakers for health monitoring and spinal cord stimulators for chronic pain management. All this information is gathered, transferred over public and internet networks to health institutions, to doctors, to insurance companies, to pharmacies, and to other concerned parties who are interested in looking at the health information. And this must be done in a secure and reliable manner. So data security is a major problem in telehealth systems, and violation has adverse social and economic consequences. For example, there is evidence of the breaches in data health globally. For example, an article on CBS News highlighted that hackers are stealing millions of medical records and selling them on the dark web. Another article also highlighting that 1 billion medical records, all containing images, were exposed due to common security oversight, usually in healthcare systems. So security requirements and implications, we're looking at the major requirements: confidentiality, integrity, and availability, where confidentiality relates to how patient health information is kept confidential from those unauthorized to hear, see, or read it. And integrity, it relates to how information can be protected against alteration, damage, or loss. And availability refers to the accessibility of patient health information where and when it is needed to provide the necessary care. Authentication and authorization are key aspects of security which support confidentiality, integrity, and availability. So the aim of our project is to develop a security framework for secure transfer of medical data in telehealth system. In our ongoing research, we have proposed a generic telehealth system which can be adapted to care homes, and the system consists, just taking here an example of a care home, but it can be any remote location, even a remote clinic, using 5G technologies for reliability, low latency, and high bandwidth that would improve the availability aspect of security. And this information is transferred to servers. In our example, we have researchers working on image processing servers. Those servers need to be protected against security breaches. So we are proposing to integrate blockchain technology and X-Road technologies. The reason for selecting these two technologies is that blockchain has successfully been used to secure transactions in cryptocurrencies, and these cryptocurrencies are distributed systems, which is now similar to the emerging telehealth care systems, which are distributed in nature, compared to previous architectures where the health systems would be like point-to-point systems. So the distributed nature of telehealth systems requires that we look at new technologies, and the blockchain technology provides that architecture. So in our case, blockchain, we're proposing that we use it for securing information while during acquisition at the source of information, and while in storage. Unfortunately, one of the limitations of blockchain is that while the information leaves a blockchain node, security is assumed to be available, and the blockchain does not secure information while it is being transferred. So the use of public and private keys in blockchain means that anyone who has got a key can actually encrypt that information and get access to it. So we are proposing also an emerging technology, X-Road, which was founded at Estonia and successfully used for e-government purposes. So X-Road, the design of X-Road is such that it is designed to protect information while in transit between nodes. So this is why we are proposing these two technologies. And blockchain smart contracts provide a platform for implementing security contracts, which are referred to contracts in blockchain technology. So we are looking at these three aspects: blockchain, X-Road, smart contracts, and 5G for improved information availability. So to validate the proposed security framework, we assume a remote location, e.g. a care home connected to a tertiary hospital via a 5G secure network. So to validate the process, we will look at captured data, and that information is secured using blockchain, transmitted securely and reliably over an X-Road platform with the backing of 5G technology, and securely stored on web processing and storage servers using blockchain technology. The image processing, once the information has been processed at the remote hospital or doctor's place, the information is also securely sent back to the data source, which can be used by carers for the treatment or diagnostic purposes. So the performance evaluation focuses on three aspects: access control on devices, detection of data manipulation, which ensures data integrity, and network performance for protecting the availability or ensuring the availability of information. And we will evaluate emerging 5G technologies using an existing 5G testbed at the University of Cape Town. So in conclusion, a secure information underpins good care, and safe data supports safe care. So old age care homes can be connected to specialist healthcare providers using telehealth systems for continuous health monitoring and early detection of adverse health conditions. The telehealth system architecture and security framework we are developing can be adapted for implementation in care homes for the elderly, as it enables fast, reliable, secure transfer of resulting in timely diagnosis and treatment. For the elderly populace under care homes, secure information underpins good care, and safe data supports safe care. Thank you very much for listening to my work. Those are my contact details.
Thank you very much, Dr. Malila. That's very interesting. Certainly, I have some catch up to do. I haven't heard of X-Road before, and that's my next assignment is to find out what it is. We've slightly over time, so very briefly, a short question. What do you think is the timeline for what you propose to be implemented in practice in your context?
What we have done so far, we have successfully implemented an X-Road instance in Germany. We were doing a collaboration project with Arnold University in Germany. So implementation at the University of Cape Town was slightly delayed because of the COVID issues this year, but we're hoping that maybe in 6 months' time, we should be at the stage where we can be testing the infrastructure.
Wonderful. Well, we'll be looking forward to hearing more about this important technology that will help protect patients' privacy as well as better serve them. So fantastic. Thank you very much.